Welcome to Malpractice Podcast. You want to get started?
Yes.
Okay,
I am Jess. I was an educator for 5 years and then worked in nonprofit and in the political space. I have a degree that is in policy analysis, public administration, and communication. So I have kind of policy, and a lot of what you'll hear from me is like how this impacts our legislation and laws. That's what I really feel passionate about. That's the way to impact people. So I consider myself a diehard advocate for people who don't have their voice.
Hi, I'm Sydney. I'm currently pursuing a PhD in neuroscience. I have a master's in public health communication, and I think what I bring to the podcast is a level of understanding from a clinical perspective. In my professional opinion, I think that communicating about public health needs to be more common and improved from researchers and doctors to the public, as well as within communities to themselves about issues facing them in terms of healthcare.
So we started this podcast because we are comfortable talking with each other about things that most people would think were uncomfortable because we've known each other for about 100 years. Actually, like over 20, but it feels like 100. So we have a relationship where there is no uncomfortable moment. We just share. But we've all been to the doctor's office or a hospital or an appointment in general, and we leave feeling confused, concerned. We don't know really what happened. We didn't ask questions because we didn't feel like we could. There's this level of we just believe what the person in authority is saying and we take that as fact, but we don't know as general public what actually is going on with our own bodies, and that's not okay. So we think it's important to set an example with ourselves of having these conversations that can be taboo, but we want to make them more accessible.
And it's easy to not address healthcare conversations with your practitioner, with your family, with yourself, with your community. And so we want to sort of help remove the stigma associated with conversations about health so that we can empower people to make better health decisions for themselves.
We were talking about several of the issues that make us angry. I'm going to just say that I wake up every day a little bit angry, and Sydney does the same. I think that really motivates us to change things.
And in that same context, we're going to cover a lot of health history and historical stories about medicine. And we think it's really important that we all learn from and how to avoid some of the horrible medical errors that have come up in American history. We also want to talk about history from a personal context so that you can have these conversations about your own health history, because we know a lot of people who don't know what their grandparents died of, who didn't understand that their parents had a chronic illness because they had never had these healthcare conversations within their own families or within their communities or with the people closest to them. Yeah. And because of that, they may be suffering from a lack of knowledge that empowers them to make better healthcare decisions for themselves.
Yeah, and then the history in general, as we know, is written by the conqueror, right? So whoever controls the narrative controls what we know. And there's a lot that's been left out that we don't have access to or haven't been exposed to in a regular educational setting. So we want to make sure that we are using this platform in a way to combat that normalized education about healthcare history and really kind of tell the truth that is, sometimes the grosser story or a situation that nobody wants to really know about, but we should all know that this is what's happened so that we can learn from the past and then not allow those things to happen in the future, so we can combat the power system and hold it accountable.
Yeah, absolutely. And we think that there are a lot of medical stories that people probably don't know about that represent a really important part of medical history and understanding how we as individuals interact with the healthcare system.
Yeah.
We also want to use this as a platform to amplify the voices of people who have been mistreated by the healthcare system. So you'll hear us do interviews affected by these structures that are in place that are not beneficial for them.
Yeah, I think we want to use the stories of others and even of our own stories to like combat oppressive systems. On this podcast, you're going to hear Sydney and I have conversations like we would if nobody was listening. So this is our authentic reaction to situations that are uncomfortable, awkward, sometimes disgusting.
We're also going to try to create a space for levity and humor within these serious conversations, because we've always found that humor is the best way to navigate difficult situations.
Yeah, for sure. We chose this topic because of how serious the implications of not understanding the healthcare system and not knowing these things are. So when we have these conversations, we're doing so in a real effort to educate. Thanks for listening to Malpractice Podcast.